Do you also brush your teeth twice a day but still gets bleeding gums, cavity, or plaque? Then the problem may not be the frequency of brushing but the technique that you are using. Hi, this is Dr. Shubhangana, and subscribe for more simple evidence based dental information. Let me show you the correct technique step by step. So, firstly, you need to choose the correct toothbrush. You don't need hard bristles to clean your teeth better. So, you need to choose a soft or an extra soft bristled toothbrush. हार्ड ब्रिसल्स का यूज करना एंड एग्रेसिवली ब्रशिंग करना, उससे आपके टीथ बेयर होने लगते हैं जल्दी एंड ऑल्सो गम रिसेशन स्टार्ट हो जाता है. So no hard bristles, no aggressive brushing, go for soft bristles only. Secondly, you need to hold the toothbrush at the right angle. So the right angle of placing the toothbrush, it is to place it at 45 degrees at the surface, at the tooth surface and the gum line. So it should make contact with both the tooth surface and the gum line. So this is important because जो mostly जो plaque accumulation है वो near the gum line होता है. So you need to place it at 45 degrees like this if you are doing at the upper teeth, and like this when you are doing for the lower teeth. Thirdly, you need to use small, gentle movements rather than aggressively brushing back and forth. So, this kind of brushing is totally wrong, and in the long run, it will lead to it does not, firstly, it does not clean the teeth properly, and in the long run, it starts leading to the wear down of the teeth surface. At a time, target three tooth. So you need to keep the brush similarly at an angle of 45 degrees, and then you need to do a sweeping motion so to remove all the accumulated debris, plaque and bacteria from the tooth surface. So similarly you will clean all the outer surfaces of the tooth, and then for the inner surface, for the front tooth, you will keep the brush in a position like this and do an up and down motion. And for the inner surface of the rest of the tooth, similarly, keep the brush at an angle of 45 degree and do a sweeping motion very gently and in a controlled manner, not hard and fast. Then after cleaning the outer and the inner surfaces, you move to the chewing surface of the tooth, that is these surfaces, and then you will do a circular motion to clean all of this and like this in a gentle manner and just clean it, and that is how the brushing of your teeth surface will get completed. Please do not forget to clean your tongue. So it is very important to clean your tongue, and you do it in a scraping motion so that you remove. For that you can use your brush, and if you are not comfortable, you feel very gagged, then use a tongue cleaner and just scrape out all of the debris which is accumulated and all the bacteria, so that you don't face the smell issue, or it also helps to just clean your mouth, the oral cavity in a better way. Aim for approximately 2 minutes twice a day and don't rush through it. Divide your mouth oral cavity into four sections and give 30 seconds to each section. A very important point, brushing alone is not enough. Interdental cleaning is very important. These are the interdental spaces, the space which is present between your two teeth. So for that, either you can use a floss or an interdental brush, especially if you have spaces or gum problems, then do use a floss or an interdental brush. If your gums bleed while brushing, then do not stop brushing automatically. You need to get evaluated by a dentist because bleeding is a sign of gum inflammation which is caused by the plaque. If you're brushing so hard that your gums get hurt or your teeth have started to become sensitive, then that means you are using too much force. So you need to stop using that much force. You need to become more gentle while brushing, and also you need to use a soft bristle toothbrush only. So remember, soft brush, 45-degree angles, gentle movement, clean every surface, 2 minutes twice a day. Good brushing isn't about brushing harder, it's about using the correct technique.